We welcome you back. It is Michael Garfield, the longest-running radio program here on 950 AM, heard across Southeast Texas and actually around the world on iHeartRadio. It is the High Tech Texan Show. We do have some open phone lines. Phone number, I'd love to talk to you. I'm just not sitting here doing it for my health people. I'm here to educate and entertain. 713-212-5950. I do like to educate because when I educate you, I actually educate me, or vice versa. I'm not sure. So, yes, we do cover the world of technology, automobiles, sports, medicine, and certainly this is a medical-oriented town, wouldn't you say? And one thing I want to focus on here for the next few minutes, especially as summer is coming up, we all want to look better. And we all want to feel better. And there was a documentary. It was not a documentary. It was an HBO show series, the movie. What was it, a few years ago? What was it? The Ross from Friends. It was like the Houston breast doctors. I think this is where the first breast augmentation or boob job, for lack of a better term, it started. Houston is known for that. And there are some great doctors. And in all sincerity, you probably know of some. You probably have had work from some. And I kind of wanted to get down to the nitty-gritty and discover the procedures, the processes. How do you go about choosing a doctor maybe in that area? And also what technology has changed over the years. It turns out a few weeks ago, I met actually one of the best, if not the best in the city. His reputation, unheard of. It's incredible. Dr. Fred Aguilar, the Houston body doctor. I have pulled him out of surgery to make sure he talks to us for a few minutes. I hope you're not keeping your patients too long, doctor. I do thank you for joining me.
Michael, thank you for having me, and no, we're good. Thank you so much.
Let me ask you this, because this is probably the most asked question that you get wherever you go, especially outside the office. I don't care if it's a cocktail party or maybe if it's a kid's soccer game. When people know who you are, people know what you do, I bet they come up and say, Doc, what would you do on me? What do I need? What's your opinion? I mean, how often do you get that?
I actually get that surprisingly often, and it's really hard in that kind of a setting to tell someone, oh, your eyes look horrible, or in this light, you're showing your age because your lower eyelids are bad. So I've always just said, let's talk about that in the office. Come see me sometime, because it's just not a good environment to do that. Yes, I've heard stories where some plastic surgeons will go out of their way. They'll tell someone at a party that they really could use their help, and I think that's just not cool. And I think it can be somewhat insulting. So I always like the fact that they ask me, tells me they're interested, and then I always tell them I have better lighting and a better place to examine you, and it's going to take a while to have the discussion, so please come see me.
I like that. I need to start using that, because I kind of, liken myself to a doctor when I'm at parties and people find out what I am and who I do. It's, oh, what kind of cell phone do you have? Oh, can you recommend a television for me? What kind of car do you drive so I can buy one? I'm like, just tune into my radio show.
Right.
I want to have fun. So I will put you on the spot here, and I'm going to throw my HIPAA. I've just signed my HIPAA out of the doorways. You and I have broke bread several times. You have seen me. We have discussed. You know how old I am. What would you do on me?
Well, golly, you looked up young in the dictionary and your picture's in there.
Love this guy.
Seriously, you have aged very well. You still have hair. I do not.
Yes,
so
I do.
You look much more youthful than I do. I think that at your age, the only things that are really showing is a little bit of lines from the usage of the muscles under your face, which make us smile, which make us grimace, which make us frown. So you're getting a little bit of wrinkling, and so you would be a great candidate as a male for Botox. So it does work well to make you look more youthful. It softens the forehead. It makes you look much more youthful.
You are going to have to really twist my arm to do that stuff, because that's a needle, man. That's a needle.
It is a needle, and it is a needle. And people go to my website, they'll see that I've got Dominique Sasa as a client, and she doesn't hide this, and she's done a YouTube on me doing her Botox, and she's very happy, and she's just a wonderful ambassador for me and for my practice, and she looks very youthful, and Botox is a magic medicine.
Well, she really looks great. Well. No, Dominique looks great. We've been watching her for years. She doesn't seem to age, and so you know what, mate? We'll talk. Maybe I will be your male spokesperson model one day.
It would be great, and I would urge your listeners to look up Dominique's video on Botox. It's on YouTube. She does a fantastic job, and she's got a lot of followers, and it helps take the mystique, if you will, out of Botox and the fear.
Speaking with Dr. Fred Aguilar, MD. He is the Houston Body Doc. We'll make sure you give out several of your websites so people can find you. When people, this is a big city. This is a big community, as you know. Very famous. Houston is for plastic this and plastic that, whether it's rhinoplasty, whether it's facelifts, whether it's Botox, maybe it's something in your abdomen, your chest, or your stomach area. What do you recommend when you tell people when you're researching a doctor, which is very important? What are things you need to check off? What are things you need to avoid?
Michael, that's a really important question, and we have seen a lot of patients going to the cheapest doctor they can find for the procedure that they want in plastic surgery. Unfortunately, that often leads them to people who are not board certified in plastic surgery, are not board certified in facial plastic surgery. We have OB-GYN doctors performing liposuction of the body. We have some dermatologists and family practitioners doing the same. And they do not know how to handle complications. They don't know the anatomy as well as plastic surgeons are trained to know the anatomy, and it sometimes leads to disaster. So my number one recommendation, make sure they're board certified. There are two different areas. I'm boarded in plastic surgery. I'm boarded in ENT, which is otolaryngology, and I've gotten my boards in facial plastic surgery. So when a patient comes to me, they're getting the very best in all three of those fields. And otolaryngologists are trained in facial plastic surgery, but make sure that they are board certified by the American Academy of Facial Plastic Surgery. General plastic surgeons, make sure they're board certified by the American Board of Plastic Surgery. And then they know they're in good hands by someone who's received the proper training. Please, please, please don't go to a doctor's in the spa. Don't go to some stranger in a shopping mall. And don't go to someone's home for injections of the butt with unknown material. It's just not the right way to do things.
Good tips, all of them. Speaking with the Houston Body Doctor, Fred Aguilar has been here well over, 35 years you've been doing this?
Yeah, I've been in practice about 35 years now and still doing well. And despite all those boards, I'm barely 100. I'm doing pretty good.
You're doing very, very well. I'm playing around on the website over here, the number of procedures that you're doing. I mean, it's not just for women, as you just talked about. People think, but I see a lot of this stuff for men, for the body, for the face and neck, and when we do hear the word plastic, we do think about breast augmentation, and you have a very nice gallery, by the way, which is it's a great way to kill some time, guys. If you actually go to his website and look at the breast augmentation,
amen to that.
That has changed well over the years between silicone and a number of different things, and I'll kind of end our conversation with that. What technology, what has changed, and it's maybe in that specific area? What do you recommend? Obviously, health being the number one concern.
Well, absolutely. The biggest technical progress has been made in the composition of breast implants. Mm-hmm. The silicone breast implants of many years ago had free silicone inside a pocket. So if the envelope around it ruptured, then you had free silicone getting out of the body and causing bad things. The new implants, we call them gummy bears because they act like a gummy bear. You can slice them with a knife and they just split open. There's no free silicone. These implants are very, very safe. The rate of capsular contracture, which is a common complication of breast implants, is very low with these, and they feel extremely natural. Many men would not be able to tell that a woman has these in place because they're that natural, and they are fabulous.
So the people could come in and just ask for gummy bears, and pretty much they know what you're talking about.
Yeah, ask for the gummy bears, and we know what you're talking about. And the name is actually cohesive gel, and so that's what the technical term is. They've made a lot of headway in the way these are created and made and manufactured, and there's a very high margin of safety now.
Breast brought to you by Haribo. We like gummy bears. It's good stuff. All right, listen. Before we let you go, give us one or two of your websites, maybe a phone number. If anybody wants to call, tell this good doctor you heard him on the radio. He's got an unbelievable reputation. 35 years or so, he is good. How do we get a hold of you?
Thanks, Michael. My office number is 713-521-4777. The website is myhprs.com, which is Houston Plastic Reconstructive Surgery, and it's also totalbodydoctor.com.